You know that sinking feeling when you open up a medical bill? That moment of dread when you're afraid to look at the number at the bottom. Most of the time, you feel that way because you have no idea how much it's going to be, how much your health insurance is going to cover it, if they're going to try to deny payment, and how much time you're going to need to spend to fight it. And if you don't know, most of the people who work in the healthcare industry couldn't tell you either. That lack of transparency in pricing and how health insurance works is a major area of stress for the U.S. public and is one of the starkest reminders in the U.S. that we live under a broken healthcare system. The recent shooting of United Healthcare CEO Brian Thompson by Luigi Mangione has sparked a national conversation that has been simmering for decades. But what's truly shocking isn't just the tragic event itself, it's the public reaction. A recent YouGov poll showed that while most Americans condemned the violence, a startling number expressed understanding of the shooter's motivations and frustrations. When a society reaches a point where doctors are pulled away in the middle of surgeries to fight insurance companies over care needed for patient survival, where people fight not to take an ambulance to the hospital for fear of the cost, and when even affluent insured people feel terrorized by their own healthcare system, we need to have a serious conversation about how we got here. Let me throw some numbers at you that'll make your head spin. The United States spends about $4.9 trillion, or about $14,570 per person annually on healthcare in 2023 dollars, nearly double what other wealthy nations spend. Yet somehow we have the lowest life expectancy among peer nations, the highest rate of preventable deaths, and the highest rate of medical bankruptcy in the developed world. For perspective, that's like buying a Rolls Royce but getting the performance of a used bicycle. And here's the kicker. This isn't just about the uninsured anymore. A recent Commonwealth Fund study found that 44% of working age Americans are either uninsured or underinsured. That means even people with quote-unquote good insurance are one medical emergency away from financial disaster. We're talking about folks with solid jobs, healthy savings accounts, and what they thought was decent coverage until they actually need to use it. Welcome to Apprentice.io's Industry Insights. I'm Frank Maggiore, and today we're diving into what might be the most complex, frustrated, and frankly broken system in America, our healthcare industry. And folks, when I say broken, I mean a system so dysfunctional that even people making six figures or more are one serious illness away from bankruptcy. Now, I've spent years working in pharmaceutical manufacturing systems, and I can tell you this, the opacity isn't just frustrating for patients, it's a nightmare for everyone involved, doctors, hospitals, drug manufacturers, even the insurance companies themselves. The system has become so Byzantine that sometimes even the people running it can't explain why things cost the way they do. But here's what makes today's episode different. We're not here to just complain about the problem. We're going to break down exactly how we got here, why the system works or doesn't work the way it does, and most importantly, what concrete steps we can take to fix it. We'll look at how modern technology, from AI to manufacturing execution systems, could help untangle this mess. And we'll explore real solutions that don't require us to completely tear down and rebuild the entire healthcare system overnight. This isn't about politics, whether you're a free market enthusiast or a Medicare for All advocate. I think we can all agree that a system where people avoid seeking medical care because they're afraid of the bills isn't working, and the lack of preventative care is leading to more expensive and worse patient outcomes. Today, we're going to look at the practical solutions that could start making things better right now. So stick around, because whether you're a healthcare professional, a policymaker, or just someone who's ever looked at a medical bill and thought, how is this possible? This episode is for you. We're about to dive deep into America's healthcare crisis and, more importantly, how we might finally fix it. Let's talk real numbers here. The United States spends over 18% of its GDP on healthcare. That's nearly $4.9 trillion annually, or about $1 in every 5 that moves through our economy. We're spending more than twice what other developed nations do per person. And what are we getting for all that money? Well, that's where things get depressing. Americans are living shorter lives, nearly 4 years less than the average in other wealthy nations. We have the highest rate of preventable deaths, the highest infant mortality rate, and the most expensive drug prices in the developed world. It's like we're paying for a 5-star hotel, but staying in a motel with a flickering neon sign. Now, how do we end up here? It's actually a fascinating historical accident. During World War II, when wages were frozen, companies started offering health benefits to attract workers. The government made these benefits tax-free, and boom, we accidentally created an employer-based insurance system that no one actually planned. Fast forward to today, and we've got this incredibly complex web where your access to healthcare often depends on your job. You lose your job, you lose your healthcare. You can go on COBRA, a stopgap plan to extend your existing coverage until you get a new job, but expect to pay through the nose to keep it. At the very same time, you are unemployed and need to reduce spending even more. And even if you have insurance, good luck figuring out what anything costs. I mean, have you ever tried to get a straight answer about what a procedure will cost before you get it? It's like asking a magic 8-ball, except the answer is always, reply hazy, try again later, and there'll be a surprise bill coming in 3 months. Speaking of bills, let me share something mind-blowing. 2 patients can get identical procedures in the same hospital from the same doctor on the same day and be charged completely different amounts. Why? It depends on their insurance, or lack thereof. One MRI machine can generate bills ranging from $400 to $6,000 for the exact same scan. That's not a typo. We're talking about a price difference of 1,500% for identical services. And here's where it gets really fascinating. This isn't just affecting low-income Americans anymore. A recent study found that 41% of adults with employer-sponsored insurance still had difficulty paying medical bills. We're seeing people with 6-figure salaries setting up GoFundMe pages for medical expenses. Even households making over $100,000 a year are reporting skipping needed medical care because of the cost. The system has become so complex that even industry insiders often can't explain why things cost the way they do. Hospital administrators have to hire special consultants just to figure out how to bill insurance companies correctly. Think about that. We've created a system so complicated that the people running it need to hire experts to explain it back to them. What's particularly interesting is how this affects public perception. Recent polling shows that the frustration with the healthcare system crosses all political and economic lines. Whether you're a progressive in California or a conservative in Texas, whether you're making $30,000 or $300,000 a year, chances are you've had at least one infuriating experience with healthcare billing or insurance. And that's not just patients who are frustrated. Doctors spend about 2 hours on paperwork for every hour they spend with patients. Insurance companies have weaponized the most precious thing to doctors, which is their time. By tying up doctors continuously on needless phone calls to make them beg to cover their own patients' treatments, they are providing a tax on doctors every time they want to provide treatments that the insurance company needs to pay for. Hospitals employ entire departments just to negotiate with insurance companies. Insurance companies themselves spend billions on administrative costs trying to navigate their own labyrinthian systems. The most absurd part, all this complexity actually makes healthcare more expensive. We spend about $925 per person annually in the US just on healthcare administration costs alone. That's nearly 4 times what other developed nations spend. It's like we're paying extra for the privilege of making everything so much more complicated than it needs to be. And remember that opacity that I mentioned, it gets worse. Many hospitals now use something called charge master prices, essentially made up numbers that no one actually expects to pay, but which become the starting point for negotiation with insurers. It's like going to a store where everything is marked up 1,000%, but different customers get different secret discounts based on complex algorithms and backroom deals. Let's follow the money and see where your healthcare dollars actually end up. And folks, prepare yourselves because this is where things get really wild. Remember when hospitals were mostly independent and locally run? Well, today we're seeing massive consolidation with giant healthcare systems buying up smaller hospitals and physician practices. This isn't just about efficiency, it's about market power. When one healthcare system owns every hospital in a region, they can basically name their price. It's like having a monopoly, but instead of charging too much for Boardwalk, they're charging $500 for an aspirin. Here's an example of how this works. A patient goes to an in-network emergency room for a cut finger. The ER doctor puts in several stitches. The bill? $11,340. Let's break that down. $6,346 for minor procedure, $4,985 for emergency room, and $8.32 for drugs. No, that's not a typo. And apparently the thread and local anesthetic cost less than a Netflix subscription. But here's where it gets interesting. The insurance company didn't actually pay that amount. They have a secret negotiated rate that knocked off about 80% of the bill. So why $11,340 in the first place? It's like a bizarre game of pricing chicken, where hospitals set astronomical prices knowing insurance companies will negotiate them down, but uninsured patients might actually have to pay the full amount. Then we have the middlemen, particularly pharmacy benefit managers or PBMs. These are companies that were originally created to help negotiate better drug prices. Today, three PBMs control about 80% of the market, and somehow drug prices keep going up while they make billions in profits. It's like hiring a bargaining expert who ends up costing you more money than if you negotiated the deal yourself. Here's a shocking revelation that perfectly illustrates what's wrong with our healthcare system. The Federal Trade Commission has just released a bombshell report exposing how the big three pharmacy benefit managers, CVS Caremark, Cigna Express Scripts, and United Care's Optum Rx, who control about 80% of U.S. prescriptions, have been systematically marking up drug prices by hundreds and in some cases thousands of percent. Between 2017 and 2022, these companies generated an extra $7.3 billion in revenue above cost, just from markups on specialty generic drugs. And according to FTC spokespersons, that's probably an understatement. What makes this particularly outrageous is the way that these companies are doing it. They're not just marking up exotic or specialty drugs, they're jacking up prices on basic, life-saving medications that treat everything from heart disease to cancer. These PBMs are paying themselves more than other pharmacies for dispensing the same drugs, while using a practice called spread pricing to bill clients more than they pay pharmacies, generating another $1.4 billion in estimated income. And they're steering patients to their own affiliated pharmacies where they can charge these inflated prices. It's like having the referees own the teams they're officiating while also owning the stadium and charging fans whatever they want for tickets. The problem is growing at an alarming rate. The FTC found excess dispensing revenue growing by 42% annually during the study period. Meanwhile, costs for patients increased by 21% for commercial claims and about 15% for Medicare claims. As FTC Chair Lina Khan put it, these companies have essentially created a vertically integrated system designed to maximize profits at the expense of patient care. The practice has become so widespread that the FTC has launched a broader investigation into how these companies are using their market dominance to artificially inflate healthcare costs across the board. It's a classic case of middlemen manipulating the system to enrich themselves while making healthcare more expensive for everyone else. Speaking of drug prices, let's talk about pharmaceutical companies. Yes, developing new drugs is expensive. It costs well over $1 billion to bring a new drug to market. But companies often spend more on marketing than on research, and they use various legal loopholes to extend patents and prevent cheaper generic alternatives. One particularly creative tactic, some companies have been caught paying competitors not to produce generic versions of their drugs. That's right. They literally pay other companies to not compete with them to extend their window of exclusivity. Now everyone in the system blames everyone else for high costs. Insurance companies blame hospitals for high prices. Hospitals blame insurance companies for denying claims and creating administrative burdens. Drug companies blame PBMs for not passing along discounts. PBMs blame drug companies for high list prices. So it's a circular firing squad of blame, and the patients are the ones to pick up the bill. And here's the truly terrifying part. No one at any income level is safe from potential financial ruin due to medical bills. The administrative costs alone are staggering. For every doctor providing care, there are multiple people handling paperwork. Hospital systems typically employ more billing specialists than beds. Insurance companies spend about 17% of their revenue just on administration. That's about 6 times what Medicare spends. We're literally spending hundreds of billions of dollars on paperwork. And remember those surprise bills people keep getting? Often they're because someone in their chain of care was out of network, even at in-network hospitals. Even if you go to an in-network doctor, they may send your samples to an out-of-network lab for testing. And guess who is picking up that entire bill? Imagine going to a restaurant where the waiter is in-network, but the chef isn't. And 3 months later, you get a surprise bill for the cooking fee. That's basically how our healthcare system works now. The most frustrating part, all this complexity and opacity makes it nearly impossible for patients to make informed decisions about their care. How can you shop around for the best price when no one will tell you what anything costs until after you've received the service? It's like being forced to buy a car without knowing the price, then getting the bill months later, and oh, by the way, your life depends on buying it. Now, as someone who works with manufacturing execution systems, let me tell you how technology could help untangle this mess. And no, I'm not talking about another app that tells you to drink more water. I'm talking about real solutions that could fundamentally transform how healthcare works. First up, artificial intelligence. We've already seen how AI tools like AlphaFold are revolutionizing drug development, potentially cutting off years of development time and billions of dollars in costs. But here, AI could do something even more revolutionary, make healthcare pricing transparent and predictable. Imagine an AI system that can analyze all your insurance benefits, medical history, and treatment options in real time, then tell you exactly what your out-of-pocket costs will be before you got the treatment. No more surprise bills 3 months later. We literally have the technology to do this right now. We just need the healthcare industry to stop treating prices like they're nuclear launch codes. Here's an interesting development in the fight against automated insurance denials. Waystar, a healthcare payments company that processes over $1.2 trillion in claims annually, has developed a generative AI tool called Altitude Create to help hospitals and patients fight back against automated insurance claim denials. Think of it as fighting fire with fire, using AI to combat AI-driven denial systems. Here's why this matters. Hospitals currently spend about $20 billion a year trying to overturn denied insurance claims. Waystar's system automatically drafts appeal letters by navigating through complex contracts and records. Remarkably, more than half of the denied claims ultimately get overturned when appealed. But many hospitals and doctors simply don't have the resources to fight every denial. By automating this process, Waystar's technology can help level the playing field, making it easier for healthcare providers to challenge unfair denials and ultimately get patients the coverage they deserve. Let's talk about manufacturing execution systems, or MES. These are sophisticated platforms that manage and track pharmaceutical manufacturing. Right now, we're seeing these systems revolutionize how drugs are made. Instead of massive batches of one-size-fits-all medications, we're moving toward personalized medicines manufactured on demand. Think about it like switching from a massive factory that only makes one type of shoe in bulk to a smart factory that can produce custom-fitted shoes for every person. For example, we're already using MES to manufacture CAR T-cell therapies, where each batch is literally made for a single patient. The same technology could be applied to produce small batches of generic drugs at lower cost, or quickly pivot production during shortages. No more situations where a single factory shutdown in China disrupts the entire U.S. supply chain of critical medications. Supply chain optimization is another game changer. Right now, most hospitals don't even know what the things cost until after they purchase them. With modern tracking systems, we can have real-time pricing and inventory management across the entire healthcare system. Hospitals could share resources, redirect supplies where they're needed most, and negotiate better prices through transparency. Here's a real-world example. During the pandemic, some hospitals were paying 10 times the normal price for basic PPE because they had no idea what other hospitals were paying or where supplies were available. Modern supply chain systems could help prevent that kind of price gouging and inefficiency. Digital transformation could also revolutionize how we handle medical records and billing. Right now, if you go to 3 different doctors, there's a good chance none of them can see each other's records. It's like if every bank you use had a completely different ATM system that couldn't talk to the others. We have the technology to fix this, we just need to implement it. Patient data integration is crucial here. Modern cloud-based systems could securely share medical records while maintaining privacy, coordinate care between providers, and automatically handle billing and insurance claims. No more filling out the same form 12 times or trying to remember every medication you've ever taken. Personalized healthcare passports and real-time cost tracking could transform how we pay for healthcare. Instead of waiting months to find out what something costs, imagine getting a real-time estimate that updates as the treatment decisions are made, and booking appointments for procedures with transparent costs with clear insurance coverage discounts, just like you do when booking a flight. The technology exists. We use similar systems in manufacturing to track down costs to the penny. But here's where things get really exciting. Combining all these technologies could create a healthcare system that's both more efficient and more transparent. AI could predict patients' needs and optimize resource allocation. MES could ensure medications are produced efficiently and safely. Digital systems could coordinate care and handle billing automatically. For example, let's say you need surgery. An AI system can analyze your insurance, medical history, and treatment options. The hospital supply chain system could ensure all needed materials are available in-network at the best price. The MES could coordinate any custom medications needed, and a digital platform could handle all the scheduling, billing, and follow-up care automatically. The technology to do all this exists right now. We're already using it in other industries. The challenge isn't technical. It's getting all the players in healthcare to adopt these solutions and harmonize to work together. But as costs continue to spiral and public frustration grows, the pressure to modernize is becoming impossible to ignore. Let's talk solutions that could actually work in the real world without requiring us to completely demolish and rebuild the entire healthcare system overnight. And no, this isn't about choosing between pure capitalism and pure socialism. It's about finding pragmatic approaches that could start working right now. Because while the problems are complex, many of the solutions are surprisingly straightforward. First up, let's talk about dramatically lowering drug costs through smart government contracting. Instead of building federal manufacturing plants, which would be incredibly expensive and inefficient, the government should establish long-term contracts with existing contract manufacturing organizations, CMOs, to produce generic drugs at scale. The government is already the largest healthcare purchaser in America through Medicare, Medicaid, and the VA. Instead of just being a passive buyer, it could leverage that purchasing power more effectively. Here's how it could work. The government guarantees to buy a certain volume of critical generic medications at pre-negotiated prices. The CMO uses their existing facilities and expertise to produce these drugs efficiently. Everyone wins. Manufacturers get stable contracts, the government gets reliable supplies at predictable prices, and patients get affordable medications. Take insulin, for example. It's been around for 100 years, isn't particularly complicated to manufacture, yet prices have skyrocketed because 3 companies control 90% of the global market. By contracting with CMOs to produce insulin at scale for Medicare and Medicaid patients, we could potentially cut costs by 90% or more. We've actually seen this model work during the pandemic with vaccine manufacturing. When the government guarantees purchases, manufacturers ramped up production at unprecedented speed. Why not apply the same model to other critical medications? The Veterans Association, VA, actually already does something similar with its own healthcare system. They negotiate drug prices directly and maintain their own supply chains. The result? The VA pays significantly less for the same drugs than Medicare or private insurers. It's like they found a cheat code for healthcare costs, but we're not using it for the rest of the system. We need more fair pricing in the system where high prices and profit margins in the US market isn't used to subsidize innovation for the rest of the world. We also need to crack down on pharmaceutical companies abusing patent laws to maintain artificial monopolies. Some pharma companies have made minor tweaks to insulin formulations just to extend patents or block generic competition. Or look at Martin Shkreli, who became infamous for acquiring rights to a generic drug and then raising its price by 5,000% overnight. These practices aren't innovation, they're exploitation, and they need to be regulated out of existence. And if we're being honest, there are a lot of inefficiencies in pharmaceutical manufacturing that have caused the entire system to be more expensive. In a highly regulated and conservative industry, change is hard, but we need to advance manufacturing to bring in efficiencies that optimize processes for reducing overall costs, improving yields, and making the system as a whole more robust. The way that the drug system was supposed to work is that drug prices remain high during the exclusivity period so that pharmaceutical companies can recoup the development costs and pay for the innovation funnel of all the drugs that failed and never made it to market. In return, once these drugs go off patent, they become generics, where they lose exclusivity and competition can step in to reduce prices overall. The pharmaceutical companies can then reinvest their money into reducing prices by manufacturing at scale, making the products better, or selling off those products to focus on newer, more advanced drugs and therapies that bring in higher profit margins. But this is not the way the system has worked in small molecule production, and even more so with the slow adoption of biosimilars or generic versions of biologic drugs. The government definitely has a role in redefining how generics manufacturing takes place and leveraging CMOs for more stable supply chains at lower prices. Next up, let's talk insurance reform. Other countries have shown us that you can have private insurance while still maintaining universal coverage. Germany, for instance, has multiple private insurers operating under strong regulations that ensure coverage is both comprehensive and affordable. They've somehow managed to provide better care for half the cost per person. It's like they're shopping at Costco while we're buying everything at an airport gift shop. We can also learn from international examples of hybrid systems. Australia maintains a public system for everyone while allowing for private insurance for those who want additional coverage. Japan requires all insurers to be nonprofit and strictly regulates prices. Switzerland has universal private insurance with strong government oversight. They're all getting better health outcomes than we are at significantly lower costs. Medicare Advantage was supposed to bring private sector efficiency to public insurance. Instead, we're seeing insurance companies use algorithms to systematically deny claims, then approve them when patients go through the arduous process of appeal. It's like they're hoping people will just give up and pay out of pocket. We need stronger oversight and standardized coverage requirements. We need strict regulations against automatic claim denials and AI systems designed to wear down patients and doctors. If a treatment is covered by insurance, the approval process should be straightforward and quick. No more requiring doctors to spend hours on the phone arguing for obviously necessary treatments or for denying anesthesia in the middle of a surgery because there were complications. Insurance companies should face significant penalties for using delay tactics, automated denial systems, or time denials that result in further patient harm. Here's a radical idea. What if we simplified the entire billing system, standardized billing codes, and procedures across all insurers? Right now, every insurance company has its own Byzantine system of codes and requirements. Doctors spend more time doing paperwork than seeing patients. We need to push for one standard form, one set of codes, one way of submitting claims. The administrative savings alone would be enormous. Doctors could spend more time with patients instead of paperwork. Hospitals could reduce their billing departments. Insurance companies could process claims faster and more efficiently. Additionally, prevention needs to be a bigger part of the equation. The government could offer tax incentives for healthy behaviors, regular exercise, maintaining a healthy weight, not smoking, and keeping up with vaccinations. Companies could get tax breaks for providing on-site fitness facilities or healthy meal options. This isn't about punishing unhealthy choices, it's about rewarding healthy ones. We also need better food standards. The FDA allows thousands of additives in our food that are banned in other countries. We're literally making people sick with our cheap food system, then charging them a fortune to treat the resulting health problems. Stricter food safety standards and better labeling requirements could prevent countless health issues before they start. Community health programs could be expanded through public-private partnerships. Imagine if hospitals got bonuses for reducing chronic disease rates in their communities, not just treating sick patients. Or if insurance companies were rewarded for preventing diseases rather than just managing them. These are just a few concrete examples of how these reforms could work together. Let's say we use government contracts with CMOs to ensure stable supplies of generic drugs. Combined with standardized insurance codes, billing, and stronger price regulations, we could see dramatic cost reductions without disrupting the entire healthcare system. The key is understanding that government involvement doesn't have to mean government control of everything. It's about setting the rules that make the market work better for everyone. Think of it like traffic laws. We all agree we need rules about which side of the road to drive on, but that doesn't mean the government is controlling where you can drive. We could also reform how we pay for healthcare innovation. Right now, drug companies justify high prices by pointing to research costs. If we increase public funding for basic research, then use public-private partnerships to bring discoveries to market more efficiently, and provided governments with a financial stake in those innovations, we have a seat at the table when setting prices that benefit everyone. It's like having the government build the highways, then letting private companies figure out the best ways to use them and to grow the pie for everyone. Remember, every other developed nation has figured out how to provide universal coverage while spending far less than what we do. We don't need to reinvent the wheel. We just need to be willing to learn from what works everywhere else and adapting it to our own unique circumstances. The technology to implement all these changes exists right now. We have the manufacturing capability to produce cheap generic drugs. We have the digital systems to make pricing transparent. We have the data analytics to identify and prevent health problems before they become serious. What we've lacked is the will to implement these solutions and the regulations to enforce them. None of these solutions require dismantling the entire healthcare system or choosing between pure capitalism and pure socialism. They're practical, implementable changes that could start improving healthcare immediately while bringing down costs for everyone. Let's dive into how we can revolutionize drug manufacturing and pricing through smart government partnerships with contract manufacturing organizations or CMOs. And folks, this isn't just about making cheap generic aspirin. We're talking about transforming how we make everything from basic antibiotics to cutting-edge cell therapies. First, let's understand the current problem. When pharmaceutical companies lose patent protection on drugs, they often lose interest in manufacturing them efficiently. Why? Because there's less profit in generics. But here's the thing, these medications are often critical to public health. Just look at the periodic shortages of basic antibiotics or the skyrocketing costs of insulin. Here's how a smart government contracting system with CMOs could work. The government identifies essential medications, everything from basic generics to biosimilars to advanced cell therapies. They then contract with multiple CMOs to ensure stable supply chains. Think of it like the defense contracting model, but for medicines instead of missiles. For basic generics, it's pretty straightforward. The government guarantees to purchase a certain volume at a predetermined price. This gives CMOs the certainty they need to invest in efficient production systems. We've actually seen this work during the pandemic with vaccine manufacturing. When manufacturers had guaranteed purchases, they scaled up production incredibly fast. But here's where it gets really interesting. Biosimilars and advanced therapeutics. Take CAR T-cell therapy, which currently costs around $500,000 per treatment. By contracting with CMOs specializing in cell therapy manufacturing, we could potentially cut those costs dramatically through scale and efficiency. Let me give you a concrete example. Right now, each hospital making CAR T has to maintain its own manufacturing facility. It's like every restaurant having to own its own farm. By centralizing production at specialized CMOs, we can significantly reduce costs while actually improving quality and consistency. Now, some might worry that this would kill innovation. Actually, it could do the opposite. By taking over the manufacturing of off-patent drugs, we free up pharmaceutical companies to focus on what they do best, developing new treatments. Plus, we could structure contracts to incentivize the development of biobetters, improved versions of existing drugs. For instance, a company that develops an extended release version of a generic drug, or by finding new ways to deliver it more conveniently, these could get preferential contracting terms. It's like telling pharma companies, focus on making things better, not just maintaining monopolies on old drugs. The system could also include penalties for supply disruptions. If a CMO fails to maintain adequate supplies, they have cost penalties built in or at risk for losing their contract. This creates a strong incentive for reliability. We could also require CMOs to maintain excess capacity for emergency situations, something that would have been incredibly valuable during the pandemic. Here's where manufacturing technology comes in. Modern CMOs are using advanced systems like continuous manufacturing, which is far more efficient than traditional batch processing. They're implementing sophisticated quality control systems that can actually predict problems before they occur. This isn't just about making drugs cheaper, it's about making them better and more reliable. For cell and gene therapies, centralized CMO manufacturing could be transformative. Instead of every hospital trying to maintain complex manufacturing capabilities, specialized CMOs could serve entire regions with state-of-the-art facilities. This would not only reduce costs, but also ensure more consistent quality. The government could also use this system to address health equity issues. Contracts could require CMOs to produce certain medications at cost for Medicare and Medicaid patients. They could mandate production of drugs for rare diseases that might otherwise be neglected. It's about using market forces to serve public health needs. Here's the beautiful part. The system could pay for itself. The savings from more efficient production and elimination of artificial shortages would more than cover the cost of the contracting system. Plus, by ensuring stable supplies of essential medicines, we avoid massive costs associated with drug shortages and price spikes. It's time to stop thinking about drug manufacturing as either purely private or purely public. What we need is a smart hybrid system that leverages the efficiency of the private industry while serving the public good. The technology exists, the manufacturing capacity exists. What we need now is the will to make it happen. Let's explore how emerging technologies could transform personal healthcare management. Because while we're figuring out the big systemic issues, there's a revolution happening in how individuals can take control of their own health. Picture this. You wake up and your AI health coach, which has been monitoring your sleep patterns through your smartwatch, suggests adjustments to your morning routine. It knows your medical history, your fitness goals, and your daily challenges. But this isn't just another wellness app. It's a sophisticated system that could spot potential health issues before they become serious problems. The timing for this digital health revolution couldn't be better. With the widespread adoption of anti-obesity medications like Wegovy and Ozempic, we're about to enter what I call the wellness window, a unique opportunity where millions of Americans will be feeling better than they have in years. As people lose weight and see improvements in their health markers, they're more likely to engage in positive health behaviors. It's like getting a second chance at health, and we need to capitalize on this moment. Think about it. Someone who struggled with obesity their whole life suddenly loses 50 pounds through these medications. Their diabetes improves, their blood pressure normalizes, they have more energy. That's exactly when we should be introducing them to AI-powered health coaching systems that can help them maintain these gains and build even better habits. And we're seeing fascinating innovations in how these digital therapeutics can work. Companies are developing AI systems that can listen to your cough and tell if you need medical attention, analyze your voice patterns for early signs of mental health issues, monitor your gait for early warning signs of neurological problems. provide personalized physical therapy guidance through computer vision, adjust medication reminders based on your daily routine and vital signs. But here's where manufacturing technology gets really interesting. Amazon's PillPack acquisition wasn't just about convenient delivery, it's about fundamentally rethinking how we take medications. With the potential of combining 3D printing technology with PillPack's easy packaging and Amazon's delivery infrastructure, patients can potentially have multiple medications combined into a single, personalized pill. Imagine instead of taking 8 different pills at different times, you can take 1 or 2 personalized pills that contain exactly what you need when you need it. The implications for adherence are huge. Studies show that the more complex a medication regimen is, the less likely people are to follow it. By simplifying these regimens through smart manufacturing, we could dramatically improve treatment outcomes. And let's talk about biologics. Those complex, often expensive medications that usually require infusion centers or multiple injections. New needle-free delivery systems are revolutionizing how these drugs can be administered. Instead of spending hours at infusion centers, patients could potentially self-administer their medication at home in minutes. This isn't just more convenient, it's significantly cheaper for the healthcare system overall. The real power comes when we combine these technologies. Imagine an AI health coach that not only monitors your health markers, but also coordinates with your 3D printed medication system, adjusting doses based on real-time data. Your insurance company could offer incentives for using these systems as they ultimately reduce costly complications and hospital visits. These digital systems could also help address our healthcare workforce shortage. AI-powered triage systems could handle routine monitoring and basic care guidance, freeing up healthcare workers to focus on more complex cases. It's not about replacing human healthcare workers, it's about making them more efficient and more effective. For chronic disease management, these systems could be transformative. Diabetics could have AI coaches that learn their individual patterns and provide personalized guidance. Heart patients could have systems that monitor their vitals 24/7 and alert them to concerning changes before they become emergencies. Mental health patients could have continuous support through AI therapists that complement their human care providers. The key is in making these systems accessible and integrated. They need to work together seamlessly, be covered by insurance, and be simple enough for anyone to use. We need regulations that ensure these AI systems are safe and effective while still encouraging innovation. This isn't science fiction. Most of this technology exists right now. What we need is the will to implement it systematically, the regulations to ensure it's used responsibly, and the infrastructure to make it accessible to everyone, not just those who could afford to pay out of pocket. The wellness window created by anti-obesity medications gives us a unique opportunity to reshape how Americans think about and manage their health. Let's not waste it. So how do we actually make these changes happen? Because let's be honest, we've been talking about healthcare reform for decades, and yet here we are, still getting surprised by $500 bills for Band-Aids in the ER. Let's start with what we can change right now. Price transparency is low-hanging fruit. We already have laws requiring hospitals to post their prices. They're just not being enforced. Real enforcement could start tomorrow. It's like restaurants being required to display health inspection grades. Nobody loved it at first, but now it's just part of doing business. Insurance companies can simplify and harmonize their billing systems immediately. They don't need new laws or technology. They just need public pressure and competition. United Health Group made $20 billion in profit last year. They can afford to hire some people to make their billing comprehensible. And either they do it now or they're forced to do it later at greater expense. For drug pricing, the government could start expanding its contracting with CMOs for generic medications right now. The VA already has the authority to do this. They just need to scale it up. Medicare could use existing negotiating power more aggressively. These aren't radical changes. They're just using tools we already have more effectively. But here's where it gets really interesting. Industry incentives are actually starting to align with reform. Hospital systems are drowning in administrative costs. Insurance companies are struggling with their own complexity. Even pharmaceutical companies are realizing that the current system is unsustainable. It's like we built such a complicated machine that even they can't control it anymore. Here's a concrete example. Several major hospital systems have started their own generic drug manufacturing initiatives because they're getting tired of dealing with shortages and price spikes. They've realized it's cheaper to make their own medications than to deal with the current market chaos. Public pressure is crucial here. The reaction to the United Healthcare CEO shooting, while tragic, has revealed just how widespread frustration with the system has become. When even wealthy, insured people are terrified of medical bills, let alone millions of uninsured or underinsured, something has to give. For long-term reform, we need to build political consensus around specific, achievable goals. Instead of debating entire system overhauls, let's start with the things most people agree on. Nobody should go bankrupt from medical bills. Drug prices should be reasonable and predictable. Billing should be comprehensible. What can individuals do? First, demand transparency. When you get medical care, ask for prices up front. Appeal insurance denials. Remember, around 80% of appeals succeed. Contact your representatives, but be specific. Don't just say, fix healthcare. Say, enforce price transparency laws, or expand VA drug manufacturing contracts. Specific demands are harder to ignore than general complaints about the overall system. Finally, support organizations pushing for reform, whether it's patient advocacy groups, medical professional associations, or public interest organizations. Find ones aligned with your priorities and get involved. The system won't change overnight, but remember, every other developed nation has figured this out. They all spend less money for significantly better outcomes. We're not trying to solve cold fusion here. We're just trying to copy homework from countries that have already figured out the answers. The key is in maintaining pressure while staying focused on achievable goals. We can modernize this system piece by piece, fixing the most egregious problems first while building momentum for bigger changes. Think of it like renovating a house. You might want to rebuild from scratch, but sometimes fixing the plumbing and electrical is a good place to start. Let's bring it all together. We've covered a lot of ground today, from the Byzantine complexity of medical billing to cutting-edge AI solutions. But here's what it really comes down to. Healthcare isn't just another consumer product. It's literally a matter of life and death. The current system isn't just inefficient, it's cruel. When people are rationing insulin, skipping cancer screenings, or setting up GoFundMe pages for surgery, something is fundamentally broken. We're seeing cancer patients forced to work through chemotherapy just to keep their health insurance. Parents choosing between paying medical bills and buying food for their kids. Seniors cutting pills in half to make prescriptions last longer. But here's the thing, this isn't some unsolvable problem. We're not trying to cure aging or colonize Mars. Every other developed nation has figured this out. They all provide universal coverage while spending far less than what we do. The solutions exist, we just need the will to implement them. The technology to fix this is already here. AI and advanced manufacturing systems could revolutionize drug development, production, and optimize process efficiencies. Modern digital platforms could make pricing transparent and billing comprehensible. Supply chain optimization could prevent shortages and price gouging. We're seeing cracks in the old system's facade. The public outrage over healthcare costs has reached a boiling point. Even industry insiders are admitting the current model is unsustainable. When a CEO's murder sparks a national debate about healthcare access, it's clear we've reached a tipping point. But here's what gives me hope. For the first time in decades, we're seeing alignment between public demand, technological capability, and industry recognition that change is necessary. It's like we finally reached that moment when everyone admits the emperor has no clothes. The next few years will be crucial. We'll either see more automation in healthcare administration, more transparency in pricing, more efficiency in drug manufacturing, or public anger will continue to grow and CEOs will need to hide behind walls, armed guards, and bomb-sniffing dogs, just like at the latest JP Morgan annual pharma conference. The companies that adapt first will have an advantage. Those that cling to opacity and complexity will face increasing public and regulatory pressure. Remember, not long ago, healthcare prices were more reasonable. Insurance was simpler. Doctors spent more time with patients than paperwork. We can get back to that, not by going backwards, but by using modern technology and smarter policies to build a better system. For everyone listening, here's your call to action. Demand transparency. Appeal denials. Share your stories. Shame companies into reversing healthcare denials publicly. Support organizations fighting for reform. Contact your representatives. The system only works this way because we've allowed it to. To my colleagues in healthcare technology and manufacturing, we have the tools to fix this. Let's build systems that serve patients, not bureaucracy. Let's use our expertise to make healthcare more accessible, not more complex. To the healthcare providers and insurers, the public's trust is not infinite. The pressure for reform is building. You can either help shape the changes coming or have them forced upon you. And to everyone who's struggled with this broken system, keep fighting, keep sharing your stories, keep demanding better. Change is coming, not because it's nice to have, but because it's necessary for our survival as a society. A country that continues to allow their citizens to die for the sake of increased profits for private companies is a fundamentally unhealthy and uncaring union. And if you can't build trust in your greatest moment of need because the system is there to take advantage of you, how can you maintain trust for anything else? Because ultimately, this isn't about profit margins or quarterly earnings. It's about human lives. It's about whether we want to be in a society where getting sick means going bankrupt and we lack a fundamental level of basic humanity for one another, or one where healthcare is a right, not a privilege. The choice is ours. The tools are here. The public demand is clear, and the time for change is now. We can build a healthcare system that works for everyone, not perfectly, but better, much better. A system where prices are clear, billing is simple, and getting sick doesn't mean going broke. A system where technology serves patients, not profit. A system worthy of a great nation. The only question is, what part will you play in making it happen? In an industry where precision and compliance are paramount, Apprentice's Tempo platform offers a cutting-edge manufacturing execution system solution. It's cloud-based, mobile-first, operator-centric, with the most intuitive UI in the industry, making it perfect for today's dynamic pharmaceutical manufacturing environments and for the production of the world's most complex drug products. Whether you're working on groundbreaking cell and gene therapies, biologics, or small molecules, Tempo provides a fully validated MES system that's both powerful and easy to use. It streamlines your processes, ensures compliance, and adapts to your specific manufacturing needs. So get off of paper batch records and discover how Apprentice's Tempo Manufacturing Cloud can transform your operations by visiting us at apprentice.io. Attention industry professionals, revolutionize your manufacturing process with the Apprentice Tempo Manufacturing Cloud, a manufacturing execution system built to streamline your operations, boost efficiency, and ensure compliance all in one powerful platform. Experience the future of manufacturing with our free 30-day trial. Scan the QR code on your screen now to unlock a world of innovation. Don't just keep pace, set the tempo as an industry leader with Apprentice. That's all for Apprentice.io's Industry Insights. I'm Frank Maggiore. Thanks for listening. Be sure to like and subscribe. Hit the bell icon for notifications when new episodes drop. Please comment on if you have any additional topics you would like for me to cover in this space, and we'll see you next week for more Industry Insights.